person, friends, brothers, sisters. We are at the fag end of this prestigious 6th World Congress of Diabetes India, and it is quite encouraging to visualize the enthusiasm. And Dr. Anand Moses made a very brilliant oration on the use of nutraceuticals and vitamins, and I am sure that this topic is again going to be a little bit controversial. I am focusing on the long-term consequences and not on the short-term outcomes of alternative therapies in diabetes. And thanks to Dr. Benshi and Dr. Krishna and Vijay Kumar for allotting me this controversial topic. And these are my disclosures. These are advertisements which appear all over the internet. And these advertisements either promise a cure, or some of them even give you promises on diabetes comprehensive care packages with natural remedies. Some of them are effective. I do agree that some of these remedies are effective, and they can probably result in lowering of the sugars, lowering of the lipid values, of course. And this is one observation that we did among our patients with diabetes. We found more than 50% of our patients are using alternative therapies, dietary supplements, along with the existing prescribed medications. And many of them hide. The reason being, they are afraid to reveal before you that they are on some OTC, they are on some dietary supplements as well for diabetes. And what's the definition? This is from the ADA. Complementary and alternative therapies of diabetes can be defined as those treatments and practices which are not components of the medical curriculum and usually not practiced globally in the hospitals. This is the widely accepted definition. And why are you and me concerned as physicians? Why are we concerned about this? And I do admit that some of these are good and some of these will have some beneficial effects, but they are variable. When the same product is manufactured by A, B, and C, there is variability in between the products. There is absolutely no standardization. There are possibilities of misidentification. There are possibilities of mislabeling. All these are published data. And many of these so-called dietary supplements and alternative medications are contaminated. And this is some data revealing the contamination or mixing it with unnatural toxic substances. And these include heavy metals, steroids, and contamination with microbes, pesticides, and radioactive products. And they can even result in lead poisoning. And whenever there are side effects, patients will come to you. And then patients will attribute to those medications prescribed by you. Doctor, you have given me a new medicine, and that is Januvia. Doctor, you have given a new medicine, it is Invokana, and that has resulted in itching and vomiting. Why? Because they believe the complementary and alternative medications 100% safe. Because they believe these medicines are not actual drugs. And hence, they will always attribute the side effects due to your prescribed medications and not due to the alternative or herbal remedies. And this is this scenario where we as physicians should have a basic know-how of the composition of these alternative medications, on the mechanism of action of these herbal remedies, and the possible drug interactions and the adverse events which can result from the use of these popular dietetic supplements. This is one example of a contamination. This is inadvertent substitution of Aristolochia serpentina for Stephania tetranda. And this was part of a very popular slimming regimen, which was very popular in Belgium and all over the internet in the online stores. which resulted in a very bad, progressive, rapidly progressive interstitial nephritis and a chronic kidney disease. And this aristolochic acid was also responsible for urothelial malignancies of the upper urinary tract. And this is widely popular, within quotations, unpopular, as a Chinese herb-induced nephropathy. Yes, these medications can result not only in minor adverse events, but even major adverse events, including malignancies. And why the cost goes up? Why the cost of treating diabetes goes up when the patients are on unproven remedies? They may substitute the unproven remedies for proven remedies. And this can happen during the initial 5 or 10 years of diabetes, when diabetes is totally asymptomatic. And later on, they will develop the vascular, expensive, debilitating complications of diabetes, escalating the cost of treating diabetes by more than 5 or 10-fold. And these are the listed, the so-called biological therapies for diabetes. Some of them are really good, very popular across the country, not only in India, even in parts of Europe, in Malaysia, Singapore. We also use a lot of our patients are using cinnamon. They may come back and tell you that I am using fenugreek along your prescription of glimepiride and my sugars have gone down. I have now reduced the dose of insulin. So these non-medical or the unproven therapies are very, very common, extremely common. These are some of the mechanisms of action of fenugreek, a very commonly used complementary and alternative medicine, a natural remedy for diabetes. It delays gastric emptying. It slows the absorption of carbohydrates, somewhat similar to that of alpha-glucosidase inhibitors. It inhibits the glucose transport. However, it's not free of side effects. It can produce diarrhea, flatulence, and in those women of childbearing age group, this is a word of caution. You have to be cautious about the possibilities of abortion. It can induce uterine contractions. Fenugreek has in it coumarin constituents. It enhances the action of anticoagulants. It enhances the activity of anti-diabetic agents. When given along with sulfonylureas or with insulin, it can produce hypoglycemia. Your knowledge on its anticoagulant action is probably important when the patient is preparing for a surgery. This is again quoted from an ADA publication. You have to advise them to stop before a surgery. And this is cinnamon. The active ingredient is hydroxycalcone. There were a couple of clinical trials, many of them poorly designed clinical trials for a couple of days and for a couple of weeks, and they have shown a reduction in the fasting glucose, but they couldn't demonstrate a statistically significant reduction in the HbA1c values. Compared to placebo, the A1C reduction was only up to 0.03%. It again can produce a hypoglycemia when combined with sulfonylureas and with insulin. This is a popular vegetable, bitter melon. When bitter melon is combined with anti-diabetic agents or with insulin, again it can produce hypoglycemia. And this is because of the presence of polypeptide P, charantin and vicin, components in bitter melon which can produce a hypo. Welcome, Benshidi. And it again can produce or induce menstruation, somewhat similar in action to the other components that I have described. And again, a word of caution, when you are prescribing this biological remedy for women of childbearing age group, it can induce an abortion. It is safe when consumed as a vegetable. However, there is no consistency in action. That is the unfortunate part of these remedies. Today it may act, but tomorrow it may not act. And hence, it is good as a vegetable, but it's probably not recommended as a medication. US FDA has been very vigilant, enforcing the law in the US. And this is on a dietary supplement capsule, many of which will have in it glibenclamide. This is glyburide, same as glibenclamide in India. So they were contaminated with glibenclamide and they were popularizing it in the shops as well as in the online stores as a supplement, not as a medicine for the treatment of diabetes. Whatever be the adversities, the sale of these complementary and alternative medications are simply going up, even in the US, which not only include the medications or the supplements, it also include some of the practices like acupuncture, some of the practices like chiropractic. Can acupuncture be dangerous? Can acupuncture be fatal? This is one fatal advice for acupuncture therapy in one of our patients in Kerala. He was not our patient, but he was a very popular boy who represented the International Diabetes Federation. He was a type 1 patient by himself, who was an advocate for insulin in type 1 diabetes, who knows everything about diabetes. He was pressurized to accept acupuncture by one of his very close relatives. And in quotations, the physician instructed to discontinue insulin. Why? Because I am going to cure your diabetes. In 24 hours, I am going to cure your diabetes. In less than 20 hours, this poor boy succumbed. He actually died of diabetic ketosis. A very, very sad story. A catastrophic event. Another one, very popular in Kerala, the sweet therapy. Thousands of patients go for sweet therapy. But this is propagated not by a quack. This is an MBBS doctor. You can see his degree there, over here. This is MBBS. And he claims stimulating the sleeping pancreas by administering a sweet dessert by name laddu. The pancreas is sleeping in type 2 diabetes. So we are going to provoke it, stimulate it. A very easily understanding statement, an explanation for the public and for the media. And naturally, it is getting lot of attention. Patients, thousands are going in groups. But what he does is he will discontinue insulin, but he will provide them with glibenclamide, metformin, and pioglitazone, along with laddu and exercise. And he will discontinue insulin. And this is a story of a 44-year-old gentleman, diabetes of 8 years duration, and he is fairly educated. He opted for laddu therapy, and he left us. And this is his case history at baseline. And this is the HbA1c at baseline. And this is when he returned to us 1 year after the sweet therapy. And here are the albumin levels and the lipid values. And these were the instructions from the physician and the team advocating the sweet therapy. You are instructed not to monitor the blood sugars during the sweet therapy, because if you are using the glucometer, it will have an adverse effect on the sweet therapy. So the patients are not monitoring. So the treatment team is absolutely safe. And none of these patients have any animosity towards this doctor or towards this therapy, despite the side effects, despite the failures, despite all these debilitating complications. Why? Because they believe that it just doesn't work for him, but it is working for the majority. So they have faith in all these quackeries. And this is a study among 25 patients whom we compared at baseline and 6 to 8 months after sweet therapy. Disappointing. These are some of the anecdotes. This is one of our patients who comes to us every year for the laboratory investigations. And he had been diagnosed to have diabetes 12 years back. And initially, at the time of diagnosis itself, he decided to reduce his body weight by 8 kilograms. And highly motivated guy, very highly motivated. And his A1C remaining at around 5.5 to 6 all these years. And in reality, probably, it has resulted from the initial weight loss. It has resulted from his very stringent adherence to the lifestyle modifications, in adhering to the daily dietetic patterns, in addition to his belief or faith in fenugreek. He is continuing fenugreek. Another case of a 62-year-old retired government clerk, diagnosed of diabetes 2010 during a routine checkup, and naturally, like many of our patients, he too was afraid of the so-called side effects of modern medicines and hence opted for a complementary and alternative medication. These were the baseline values, and this is when he registered with us this year with an A1C of 12.3, and he came with a bilateral proliferative retinopathy and an albuminuria. This is something which we should appreciate and make our patients and public understand. Diabetes is a chronic disease. Diabetes is a progressive illness. And being a progressive illness, the natural history of diabetes will result in a necessity for almost all the patients requiring injectables to sustain life, not only the oral therapies. So this is the truth in diabetes. Whenever the patients are surviving and surviving longer, especially if they need to survive without the devastating complications of diabetes. We do have rules, we do have laws in India. This is the Drugs and Magic Remedies in India, 1954. And we do have the law in India enforcing us not to advertise on cure of illnesses, including, you can see the diabetes listed over here. However, in the US, the FDA is very stringent in enforcing the law to see to it that it doesn't happen in the US. And this is on the Ayurvedic products from India, in which the ingredients are not declared. If the ingredients are declared, it is fine. The Ayurvedic products which originated from the healing arts in India, which claims to treat, cure or prevent diabetes. And again, the homeopathic remedies which claims of treating the complications of diabetes. Thank you very much, Dr. Benshi. Benshiji, thank you. And the prescription drugs for diabetes sold by online pharmacies, and that again without a prescription. So the US FDA has been so stringent in enforcing the law, and the Ayurvedic products are seen with suspicion in the US, especially because of some contamination with lead, with glibenclamide, pesticides, and because of the reason that they are promising cure for diabetes. This is the future. Diabetes being a chronic illness, diabetes being a very ancient disease, the claims for cure will easily attract the patients because they are already disappointed and depressed because of the complications of diabetes, because of the escalating cost of treating diabetes. And because of these reasons, these unproven therapies are likely to exist. And we need position statements from scientific bodies, including the Diabetes India, RSSDA, the API. And we need the lawmakers to stringently enforce the law. And what should be our decision before our patients? What should we do? And this is as per the international organizations. When our patients are on such therapies, don't just tell the patient to stop. Let them continue. If they have the faith in that medicine, and if you are sure about the ingredients in it, and if you are sure about the mechanism of action and about the adverse events, probably they may continue. But if you have a suspicion on contamination or on side effects or interaction, they should discontinue the medicine. Always respect the health beliefs of your patient. They may have more belief in alternative remedies. Believe it. Let them believe it. And respect the belief. In the meantime, you can counsel them. You can address those concerns in an unbiased manner and then resolve it. Over to your cartoon. This is my last slide. This is way back in 2005 when he has been so excited at the discovery of an insulin plant for his remedy for diabetes. Very cheap remedy. So excited because it is totally free of side effects. This is popular not only in India but also in some of the neighboring countries. And this is the same patient after 10 years of insulin plant. And this is in 2015. The poor guy is blind. The kidneys are gone. He is amputated. And we as responsible physicians should probably have the courage to advise our patients on accepting only evidence-based medications. Thank you so much for your patient listening and for the opportunity.